Warm welcome everyone to the OxWell Insight Seminar. So what we're going to do is just give you a little bit of an overview of what's been happening over the last few years, what we've been learning. I've asked some of the researchers who are working on the OxWell study team to present some of the findings, especially tailored to those of you working in schools who've put so much time and effort into this. And we'll be really focusing on a few areas like self-harm, like sleep, like school experiences, like gaming. So areas that I think are really pertinent, really everyone's kind of really curious about. And so I'm very grateful to the researchers who've come along today as well. We've got Jeanette here, who's involved in helping us kind of with the logistics. She comes from a commissioning background and commissioned the survey in Berkshire when she was working there. We've got Pauline here from Foster and Brown Research, who runs the survey, and we'd like you all to use the Q&A and to ask as many questions as you would like regarding the survey. So, while we're talking, please just ask questions about anything. If there's time at the end, we might open it up for broader questions, but please use the Q&A as much as possible. Another really important thing for all of us is that if there are areas you think are really important for us to be thinking about or asking about in the future, also just put that into the Q&A for us. So we will keep a note of all of that. We're designing the survey for 2023 now. The 2023 survey will be February to March. And so what I'm going to do is share some slides, and then I'll hand over to Chris Price from Liverpool, who's going to share a little bit about what they've been doing locally as well. So the OxWell Student Survey is a really large-scale survey. So students answer an unbelievably large number of questions that vary generously, because it can be around 200, and depending on how young people answer, up to 400 questions. That's run in school within a class, and it takes about 45 minutes to complete mostly. It's been done on 9 to 18-year-olds. So, and we're planning mainly to be focusing on years 8 to years 13 moving forward. It has been conducted across 4 regions in England, and it really is a big collaboration. So our local authority partners are key. The local authority in education or public health are the ones that commission the survey and ask the schools to participate. And actually that's really, really important to us, because we actually want the findings to be of use locally. We want people to look at the findings. And one of the big things that we love about the survey is that all the data becomes available back to the schools through a platform called Load Seeker. And we do a lot to try and help schools get more and more information out of Load Seeker. And it's something we've been learning about and hope really to be a strength moving forward. So it's what we call a kind of data-informed approach to mental health and well-being. So everyone's kind of concerned about the well-being of their student population. We want to actually base that on facts. So we ask the students about their worries, about their preferences for support, and you'll hear about that when we hear about the self-harm. We want to provide schools and services with that information, and we want to also, moving forward, develop a platform to test interventions. So what's new moving forward? Well, we're going to get results of our partner schools in much sooner. We're going to do it a different type of year in February to enable us to do that. We're going to really add new questions around the cost of living concerns, which are very great, around disordered eating, around risky online behaviours. We want to improve our communications. We got a new website we'll email you about next week. And then just more surgeries about how to get the most out of data. And moving forward, we plan a special school survey. So we'll email this to you, so I don't need people to take too much note of it. But for those schools that are involved in the next wave, these are just some key dates for you to be aware of. So before we move to the first talk, though, I will ask Chris now to share a little bit with us from Liverpool. Thank you, Chris.
Thanks, Mia. Afternoon, everyone. So I'm just going to give a quick overview of our experience. I think from a Liverpool point of view, we're very much at the start of our journey when we're looking at the data-driven approach of looking at mental health needs. Now, when we joined in with the survey, we were hearing a lot of information from our schools telling us that mental health needs to be a priority within schools and that mental health issues were rising, but we didn't have a quantifiable understanding of what was going on. We had a service spec and a service understanding of usage of services, but not necessarily why children were going to the services or needing to go to the services. So we joined in the survey to try and get that understanding. And at this point in time, we've got one data set, which allows us to know at that point in time how our children were feeling, what they think of school, what they think about other mental health issues. And it gives us a real good understanding of that point in time. For us, though, we need to look at this as a longitudinal survey. We need to look at this at a period of time, and how the data changes in a positive or negative way, and what interventions we can put in place so we are making informed decision making. From a school's point of view, we've been trying to work with them to allow them to use their own data, and trying to get them to reflect upon the load seeker and the data they have for their own school to make informed decisions on a school-based level. So to do that, we launched a grants program for the school so they could bid into, and how they could connect what was going on within their school, what the data was saying about their school, and interventions they could put in place on a school level to try and address some of those issues. Now, for me, the main objective there was to encourage the schools to try and look at the data, because the first step to moving forward for them was to look at the data and trying to get an understanding of how it can be used. The interventions they put in place, some will succeed, some will fail. We know that when we do anything like this, but unless we do it in an informed approach, then we will miss the point and we can't evidence whether we are doing things right or wrong. So that's how we kind of start to look at things at a school level. Moving forward, we're looking at some more upscaled interventions, which we'll work with the university to research and to understand the impact they have and the changes they might have. And then when we look at it on a city level, the main objective is to challenge the system in many ways, to challenge the system in a way which is positive, where we've got information from a child's perspective to try and give an understanding of what they think, where they want to go, what the barriers are for them to access service, and what their specific needs are. So we've been presenting the data in many forums. I can probably do a 40-minute presentation without even looking at the slides now. And it's really focusing on, okay, these are our big issues, this is what we think. Now, we've decided on 3 priorities under the guidance of the university for the city: loneliness, sleep and bullying, which allows us to look at this at a school-based level. But working with the clinical commissioning group and the transformation boards and the public health department, it's allowing us to inform our service spec when we're moving forward about alcohol, tobacco, drugs, and the needs which can support schools. So some of the medium-term support we can put in place. It allows us to look at the barriers to children accessing services and where they want to go for support. So it allows us to look at upskilling our school staff, because that's where the children are saying they want to go, to a level of being able to support them, not to counsel them, but to be able to support them appropriately. And it's looking at the different ways we can do this. If we give one example, because Mina knows I'll go on, and she said 5 minutes, and I said I'll get it down to 3, Lion. But if we give one example about one of the priorities of bullying, we had an assumption locally that the majority of our bullying took place online, and there was a big increase in that. But our surveys were telling, our information told us that 50% of our bullying took place in school out of lesson time. So that might be on the playground, around the toilets. So it allows us to know where we can put our resources to look at this. It also allows us to look at the support the schools who've got the greater need, to look at their approach. And it also allows us to look at the schools who have good practice in place and try and support and evidence their approach as well. So we are, I suppose, just to highlight, we are certainly at the start of our journey. The journey is going to take many, many years to get to where we need to be. But if we can change the way we think and change the way we act and do it in a more informed and less anecdotal way, it will really allow us to do this and to be more efficient with our resources. So that's kind of where we're up to in Liverpool. For any Liverpool schools who are on the call and services support, and I think it is to highlight the thanks and support, because from a school base, we know how difficult it is, the challenges to conduct a survey like this, but we hope that the benefits of it will be something which will really support schools and support the children moving forward. So it's a little bit of a plug as a thank you, Mina. Sorry for getting that in, but I think it's really important to highlight the importance of the school role in this and to thank them for it.
Great, thank you very much. And again, Chris is here, can answer questions and answers, but Really interesting, isn't it, to see, things like bullying, where it's happening, how to intervene, and how actually getting the data enables us to do that. So we'll move now into our specific presentations, and I'll ask the presenters to introduce themselves. So we're starting with two presentations on self-harm.
Hi, thanks Mina, and thanks everybody for coming along today. My name's Rowan Borshman. I'm a psychologist and a self-harm researcher working on the OxWell project with Mina and her team. And I just wanted to ask first, Mina, am I doing my slides before Gellies?
I can't undo my camera.
Yes, I've got yours, Rowan. Carry on, Rowan.
Okay, sure. So just as a quick bit of background prior to this slide, actually, we asked all of the students whether they had ever self-harmed in their life, whether they'd done it in the past 12 months, and whether they had done it during this first lockdown in 2020. And so we found that around 6% of the responding students reported that they had self-harmed during lockdown. And it was predominantly a female behaviour, as you can see from this slide here, but that works out to about 1 or 2 kids per classroom. So it's certainly not, it's not an insignificant behaviour. And I'm going to be focusing on the help seeking after self-harm today. So we also asked the students what services or what supports they had accessed after self-harming and how useful they found those supports. So if you could just, you can see there that around 2 in 5 unfortunately reported that they hadn't accessed any support after self-harming. So that's the headline finding we want to try and turn around. So hopefully you can see along the bottom here, we've just got the different types of responses to the supports that students reported accessing. And hopefully what stands out to you here is the big bar on the right there where it says no one. So that's the almost 40% of people that reported not accessing any help afterwards. But the next most commonly reported aspect of support was friends and family. So you can see there that friends was the second highest rated level of support accessed, followed by parents and carers, which it can be good news, can be bad news, because you can see there, perhaps on the next slide, Mina, we've got, I've highlighted here some of the professional services like CAMS, the Adolescent Health, Mental Health Service, GP, social worker, psychologist, psychiatrist, were all accessed by far fewer students who had self-harmed, which is a little bit distressing to see. And I was particularly surprised by the red square on the right there, where it's the internet-based or phone-based services. So these are things that are free, they're anonymous, they're accessible to almost everybody with internet connection, which is essentially everyone these days. But kids were reporting that they just weren't using these services for whatever reason. And so I think one of the things we need to do looking forward is to figure out why these services haven't been accessed and why the health services weren't accessed as often as friends and family. Now, the green square there you can see is for the school nurse or the welfare staff. And it looks like around 1 in 7 reported that they had accessed that service. That could be encouraging because this was during lockdown too. So presumably and hopefully when kids are actually on the ground at school, that number would be even higher. But I think that we can take away that they're hoping to access these kind of services. If we move to the next slide, we looked at what they rated as the most helpful support. And the big bar on the left there, the big red one, is for the people that reported not accessing any services. 80% of them found that this wasn't a very helpful course of action. So they're not actually accessing any support and they're not finding that very helpful. So hopefully we need to turn that around. The next blue square on the right there is for friends and parents, which is actually the most helpful. The students rated this as the most helpful. So they were going to friends and family the most often, and they were finding that the most helpful. So again, you can see the health services, perhaps slightly less helpful. The formal services were rated as less helpful after self-harm than the informal services. We go to the next slide. So we finally asked the ones who didn't report accessing any help why they hadn't gone to any services or why they hadn't accessed help. And you can see here there are still some, self-harm is quite a stigmatized behavior. So a lot of people won't want to admit that they've done this for various reasons. We're not surprised to see things like worried about confidentiality or worried about what people might say. But the square down the bottom that I've highlighted that didn't know where to get help, I think this is where we are doing the students a disservice, because only 12% reported that they didn't know where to get help, which obviously means that the vast majority did know where to get help, but they were still choosing not to. So that's what we need to tap into with the 2023 survey that we're designing at the moment, to really try and figure out how we can make services more helpful and more user-friendly for the young people, and also how we can overcome the barriers to them accessing those services. So I'll leave it there for now. I think I'll hand over to Gailey for her self-harm slides.
Hello, everyone. Good afternoon. My name is Galit. I am a researcher based in the University of Oxford, and my main area of research is suicide and self-harm. And I'm also the self-harm research lead in the OxWell study. And I'm very pleased to talk about a paper that we published very recently about loneliness and self-harm, where we used data from 2020, which was just after the first lockdown around June, July 2020. Next slide. So what we were aiming to do in this study was three things: is to assess the extent to which young persons felt lonely during the first UK lockdown in 2020, and also to estimate the proportion of adolescents who self-harmed during lockdown. And finally, we wanted to look at the associations between loneliness, but also change in loneliness with self-harm during the first lockdown. So we used data from 2020. These data were collected in June, July, and as I said, it's just when the UK started opening up after about 3 months of lockdown, and we used data from adolescents, and it was more than 10,000 individuals aged 12 to 18. And these individuals were asked about loneliness. And when we asked about loneliness, we asked about the intensity of loneliness, but also about the change in loneliness during lockdown and about self-harm that occurred during lockdown. Yeah. So in terms of what we found, so our first question was about frequency of loneliness, and we found that 1 in 6 adolescents reported that they often felt lonely during lockdown. And then we were asking them about how they felt in relation to the pre-pandemic in terms of loneliness, and 1 in 3 said that they felt lonelier than before. And when we asked them about self-harm, it was 1 in 15 that reported that they self-harmed during lockdown, so during these 3 months. So the next thing we wanted to ask to find out is about the association between self-harm and between loneliness and self-harm during this period. And what you can see is that, so the first item, the first indicator of loneliness was the frequency. And as you can see, is that as loneliness intensifies, the risk of self-harm goes up. So this is what you're seeing. I don't know if you can see my pointer or not, but it's the first, exactly, it's the first one. In the second question, we were looking to see how change in loneliness during lockdown was associated with change in self-harm or in the risk of self-harm. As you can see, feeling lonelier during the pandemic relative to before the pandemic was associated with greater risk of also self-harming during lockdown. Next, please. Next, it's done. So what does it all mean in terms of interpretation and implication? So first of all, the first thing to point out is that the proportion of individuals who said that they were lonely, or they said that they were feeling lonely often in this study, were higher than what was documented before. Now, in this area, there isn't too much about adolescents' loneliness, but I found some studies from 2018, and they actually documented about 11% in this age range. And also, our study echoes other studies from the UK, which shows that adolescents felt lonelier than before the pandemic. So overall, what we see here echoes the concerns that were about the pandemic and the measures that follow to curb the spread of the virus in terms of adolescents' mental health and loneliness. Okay. Also, we found that 7% self-harm during lockdown. Now, that is a 3 months period. We don't have any data to compare, but the interesting thing to see here is that this is quite a sizable proportion of adolescents that were dealing with significant distress and were in need probably of some support, which they may or may not have had it because of the changes to their social and educational routine. And the other interesting thing to note here is that change in loneliness was related to the risk of self-harm. So that might, if we replicate this information, might be related to how we address self-harm also through addressing loneliness. So taking it all together, it calls for obviously an urgent need to address loneliness within the school context to help individuals to actually address their loneliness. And also, and this is the final point, if you can just, we need to consider also how loneliness can work as a component in strategies for addressing self-harm in adolescents. Thank you very much, and hand over to Mina.
Super, thank you very much. It's so important, that, isn't it? So we're learning a lot about that, and it links back to what Chris said about the importance of thinking about loneliness, and actually schools are in a unique position to address that. I always think in mental health services, I'm a child and adolescent psychiatrist. In a clinic setting, I can't actually do much to change loneliness, but actually schools have so much in their power to enable young people to authentically kind of make those connections. So thank you very much. So we're now going to move on to learn about sleep. So Gabby.
So, hello everyone, I am Gabby Illingworth, and I have a particular interest in adolescents' sleep research and intervention. So just before I talk to you about the slides which look at the OxWell 2021 data, just to give you a bit of background to sleep and why it's important to look at it. So we know that sleep is important for many areas of our lives. So including, for example, our physical health, our mental health, our mood, emotional regulation, learning, memory, creativity, our immune system, and the list is really extensive. So also before I talk to you about these slides, there are changes that happen in adolescent sleep. And adolescent sleep has been referred to as the perfect storm of sleep with good reason. So we know there are changes to the biological regulation of sleep. So this refers to the sleep systems, the 2 sleep systems. So we've got the circadian system, so our body clock, and this delay, so there's a shift in sleep timing. So adolescents want to go to sleep later and wake later. And also there's a change to the homeostatic system. So this is our sleep drive and our sleep pressure, and this accumulates more slowly in the adolescent years. So this again means that adolescents want to go to sleep later. So bearing this in mind, so looking at these slides here, so looking at the slide on the left where we ask them about thinking about the past month, to what extent has poor sleep troubled you in general? So we've got the year groups on the bottom of this graph and percentages, and then the different categories that the young people responded to. So here we can see an increase in the self-reported sleep problems from primary school up until the FE years. So we've got 6 to 9%, so almost 1 in 10 in years 5 to 8 report that poor sleep has troubled them very much. And then this goes up to 17 to 19%, so almost 1 in 5 in years 12 to 13. And then if we look at those who responded to somewhat, so we've had 19 to 26%, so around 1 in 4 to 5 students in years 9 to 13 say that poor sleep has troubled them somewhat. And then looking at daytime sleepiness, we asked them, during your daytime activities, how much of a problem do you have with sleepiness? So here we can also see a clear increase in reports of daytime sleepiness across the years. So we've got 14 to 23%, so up to around 1 in 4 reporting big or very big problems with sleepiness in years 9 onwards. And we can see a corresponding decrease in those saying that sleepiness is a little problem or no problem at all. And then the next slide, please, Mina.
It's there going.
Sorry. So looking at, we asked them how long it took them to fall asleep. And I was surprised when I looked at these data. So we asked them, these are broad categories, but you can see here it's fairly consistent across the year groups. So we've got around 17% reporting that it took them about 60 minutes to fall asleep. And then we've got 24 to 29%, so around a quarter of them are saying that it took 90 minutes or 2 hours or more to fall asleep. So this seems high for all year groups, even the younger students. And we also asked them about how often they've been so worried about something they couldn't sleep at night. So there's a slight increase in the rates here of those reporting that worry stop sleep across the year groups. And when we combine the categories together, so somewhat, sometimes, and most nights, every night, then 41 to 49%, so nearly half of students in the older year group say that worry stops their sleep sometimes or more often. So, and then looking at sleep and gender. The insomnia rates in females are higher than in males. So looking at this, this item comes from an insomnia screening questionnaire that's used in adults. And I thought it was interesting that here we've got around 1 in 5 boys and 1 in 3 girls reporting that poor sleep troubles them somewhat or more. And then looking at worry stopping sleep with gender. So 1 in 10 boys and almost a quarter of girls are saying that worry is stopping their sleep most nights or every night. And then thinking about sleep tips. So importantly, sleep is modifiable. And these are just 3 tips that I have for you here. So keeping a regular sleep schedule. So trying to keep as consistent as possible bedtimes and wake times. And then also thinking about sleep pressure. So having enough sleep drive when you go to sleep so that you can sleep. And also feeling calm and relaxed. And I think this really points back to those the findings that we've got about worry stopping sleep. So there are all sorts of things you can do, like progressive muscle relaxation, guided imagery, putting the day to rest, and having putting these into a relaxing bedtime routine. And on the right, we've got a sleep poster that young people produced from the OxWell data. And I think that was emailed to schools and is available on the website. And then lastly, sleep lessons. So the OxWell team is involved in a group that's looking at creating a series of sleep lessons for schools. So we'd be really happy to hear from you if anybody would like to take part in trialling these sleep lessons. So you could get in touch with us via the OxWell email address. Thank you.
Great. Thank you very, very much, Gabby. And actually sleep is something that really schools can address. It seems to be a non-stigmatizing way to think about a whole range of mental health problems that can be affected by sleep. And so actually, we're really keen to try and do what we can to help improve sleep. And Gabby's been involved with that. Gabby also works a lot with the schools in Berkshire. So if you're a school in Berkshire, to access your data, Gabby is probably someone you might have heard from. Okay, so over to Emma.
Hello, I'm just trying to sort out the spotlights. Hi, I am Emma Samuelson. I am a researcher at Oxford as well, and I've been working on the OxWell data as part of my PhD. And it's really good to hear how Chris and others are using these data to inform how we think about mental health support, because that's something that I'm really interested in as well. And specifically, I was really interested to learn a little bit about how students perceived school-based mental health support, because we know as part of the Green Paper and other initiatives that we've made a lot of progress in terms of getting mental health support into schools. But I really wanted to learn a bit about how young people are viewing this. And so specifically, I wanted to understand whether their school experience, as well as their perceptions of their wider school culture or school climate, related to how they viewed school-based support. And I was interested in whether they knew who provided mental health support at their school, whether they perceived it as being easy to access, and whether they intended to access it if they felt they ever needed it, or whether they had actually previously accessed school-based support. And what I found was really interesting. I forgot to credit her. These are all by Indiana Montague, all these lovely illustrations that she's done for the OxWell team. But what we found were that students who had a more positive school experience and who had better perceptions of their school culture tended to have better outcomes across all of those domains that I've just named. So they were more likely than their peers to know who was providing support, perceive it as easy to access, and to have accessed it. And in particular, the three kind of areas that came out on top were perceiving the school to have a positive environment. So being welcoming, supportive to students, as well as making sure that the student voice was heard within that school environment. So did students feel like the adults at their school listened to their opinions? Did they feel like they could talk to adults about their issues and to ask for help if they needed it more generally, even outside of mental health support? And also, did they enjoy going to school? Did they enjoy the school experience, but also how did they feel about the amount and variety of extracurricular opportunities their schools offered? And so what this said to me was that we can't just airdrop in mental health professionals into schools and hope for the best. We really need to contextualize it within a wider school environment that values mental health and well-being. And I know that all the schools on this call right now are schools that value mental health and well-being. And so to you, I would say to make sure that you're not just focusing on that targeted support, but that you're also building it more of a whole school approach as well that encourages young people to ask for support and to reach out to adults at the school when they do need help. So that was a little bit on the school experience work that I've done in school-based mental health. But another area that we looked at during that first lockdown as well was the students who actually felt happier during the lockdown. And so this study came about working in partnership with young people and parents and carers. During that first lockdown, we were hearing from a number of young people and their parents that actually there was a subgroup of young people who felt their mental health had improved during this time, which I found really interesting because overall on all of the media, it was much more about the negatives, about the mental health crisis and the new pandemic of children's mental health. So we in the OxWell team were able to explore this a little bit using the data that we had collected. And so seeing as Gabby just did a talk on sleep, I would like to make sure that everybody on this call is not asleep and ask you what percentage of young people you think felt happier during lockdown. And you can post that in the chat or the Q&A. A little mid-webinar participation. I'll give you 15 seconds. So what percentage of young people said that they thought their mental well-being had improved during this time? 25%, 20%, okay, 20%, 20%, 24, very specific 24%, love it. 35%. These are all really excellent guesses, and you must be really clued up on this, because I think most people thought that it would be 5 to 10%, but actually, and Mina, you can click, what we found is that you were pretty spot on with your guesses. We found that fully 33%, or 1 in 3 young people, reported that they thought their mental well-being had improved during this time. And remember that this is already a couple months into that first lockdown. So in your average classroom, what this means is that up to 10 students, give or take, may have felt that they had better mental well-being during lockdown. And you might be thinking at this point, you know, the pandemic, we are over our lockdown phases. We're all back in school. Emma, we've been in school for a long time. Why are we presenting this data now? And what I want to challenge you to do, especially if you work in a school, is actually to think about the longer term implications of this work. So we know that 1 in 3 kids felt happier during lockdown. I want you to try to check in with the young people in your class that you thought might have had better mental well-being during these times, and try to learn a bit about why they felt that way. So our data, we're showing things like decreased bullying, improved relationships, improved sleep, improved exercise during this lockdown, and suggested that those might be reasons why some of these young people felt better. And so learn about your students who felt better, why they did, and then I challenge you to try to figure out some ways and be creative about how you can take those positive aspects of the lockdown moving forward. So is there some kind of flexibility that you can add to the curriculum? Is there some way that you can focus on building relationships in your class? I think all of these things are really interesting to still think about moving forward, even if we are back in school already. So thank you very much.
Thank you. Simona, Karen, can I just ask whether you could give your talk next, because my PowerPoint bizarrely has just crashed. So Karen, if you could do yours, then we'll get ready for Simona. So thank you.
Should work. Let me just see if I can
If you'd
share.
like to introduce yourself as well, Karen.
I will. So I'm Karen Mansfield, and Mina and I worked together from, gosh, I think September 2018, I think was when we started working together. Our just slept and breathed our entire lives were, I think, OxWell when for the beginning part of the project. So if I can just go into slideshow and there we go into this and then share. So basically all I want to do is talk a little bit about and I've literally kept to the plan here and only 3 slides, and to talk a little bit about how OxWell is different from many other kind of research studies and school-based studies that collect data. So many surveys that go out within schools, which are intended to inform schools, will also ask students who they are and will track them, and essentially can then feed back to teachers and to others who might be able to support the students. For example, you know, signal any who might be suffering with their mental health, and the students could actually kind of work out who these were. And initially, when we started out, we hoped to be able to make the OxWell data, in fact, into a longitudinal data set. And so not to necessarily ask names, but have some kind of code name so students could log on and then be tracked. And we could see how their mental health and their well-being and how other factors that are relevant to the school were changing. And so we decided before we did this that we would actually ask the students who participate in the survey what they think about this. And so that we could then decide, you know, how important it was to be able to link the data and what we would do moving forward. And so what we did is, first of all, we let students complete all of the measures in the survey. And then at the very, very end of the survey, we described to them how data linkage works. And so essentially, what would then happen is that we'd ask students to fill in the survey using some kind of code, little hash or passwords that would be unique to them. And so not that we would then have their names necessarily, but there would be something that we could use to then link their data. And so we described this to the students, and we then asked them 2 questions. We asked them, if your responses to this survey could be linked to other information on you like this, would you mind? And what we were really, really keen to know was, if your responses to the survey could be linked to other information on you like this, would you have answered any of the questions differently? And then we asked them to respond on this scale, which you can see goes from not at all, some of the questions they might answer differently, and to a great deal. And so some of these results we were particularly interested to see. And so we've got measures in the survey, as you know, of anxiety and depression. And I've put the actual numbers in here in these figures. And so what you see is that these are students, for example, who are not reporting many symptoms of depression and anxiety. And there actually you see that most of them said that they wouldn't really answer their questions differently if they could be linked. And so if we asked them to fill in a code name. And then there's a smaller proportion who'd say, yeah, I might answer some questions differently. And again, a small proportion who'd say, yeah, I'd answer a lot of questions differently. And so this kind of looks encouraging. But then if you look at those, for example, who are experiencing symptoms of anxiety, what we call above the diagnostic threshold, then actually a considerable number would say they'd answer many of those questions differently. In fact, even more than in this case than said that they wouldn't answer the questions any differently. And then again, we're seeing kind of similar patterns, especially stronger actually for depression. So again, if they don't have symptoms of depression, then they're really not worried, and they have a good attitude, and they don't mind if the data is being linked. But if they have many symptoms of depression, then a much larger number are saying, well, yes, you know, if the data could be linked, then I'd answer a lot of questions differently. To a lesser extent, you see a same pattern for those who are reporting their well-being as being low. So this is the ones with poor well-being. Again, there's quite a large number here saying they'd answer lots of questions differently compared to those with good well-being. And these are the ones who've said in the survey that they've previously accessed mental health support. And so again, a slightly larger number, but to a lesser extent that you're seeing with depression and anxiety. And then when you get to kind of the more sensitive questions in the survey, and these are the questions which we think that OxWell is particularly good at addressing, because we don't ask for identifiers, and because we're trying to understand social determinants of mental health difficulties. You see around self-harm. So those who haven't reported self-harming, again, most of them don't have negative attitudes at all. They have a positive attitude and wouldn't really answer questions differently if they could be linked. But again, you see this pattern here where those who are reporting that they did in fact self-harm, and here these students have also given us a text confirmation which meets the definition of self-harm as Ben earlier defined. So go back to Galit and thank Galit for that. Again, a great deal of them are saying they'd answered many questions differently. And you see a kind of similar pattern here with substance abuse to a slightly lesser degree. But again, if they've reported taking illegal drugs at some point in the survey, then again, they're reporting that they would be more likely to answer questions differently if the data could be linked. And so this, for us, these findings were key to stick to the way that we were already collecting the data, and to focus OxWell on those kind of questions which might be answered to some extent less accurately if we were aiming to collect the data in identifiable form, and if we did try to link it. And so, Mina, I hope Simona's slides are now ready to go to her presentation, but I'll be happy to have any questions on this at the end.
Thank you very much, Karen. So yes, this is, I suppose, some of the most interesting findings for us, isn't it? That actually we need to be collecting surveys the way that we're doing in OxWell if we really want to get kind of as accurate data as possible from young people. So I can share my screen now. Simona, sorry about that. So Simona, please introduce yourself.
No worries at all. I thought you were just trying to sabotage my gaming section. I'm Simona Skripkowska. I'm another researcher in the OxWell student survey, and I focus on child and adolescent mental health, especially in the times of the pandemic. However, for this work, me and Mina wanted to look into the gaming profiles of the adolescents in the OxWell study. So obviously gaming is one of those things that it's quite hotly debated on whether it's bad or whether it's not connected with mental health. So what we try to look at, if you can click next, is to see what's happening in this large data set of basically 13,000 adolescents who provided some of the gaming information for us. So generically what we saw is that indeed there was no connection between the time spent playing video games overall and the well-being. And around sort of a quarter to fifth of the adolescents said that they played no video games at all. Half said that they played some video games, and the substantial proportion, so nearly a third of adolescents, said that they played games for more than 3.5 hours a day. And when we look deeper into those heavy gamers, the sort of their relationships with well-being and their gaming behaviors wasn't as straightforward. So if you click next, we investigated that by trying to classify these 4,000 adolescents into sort of different gaming profiles based on their gaming behavior. And what we found is that around 44% of our adolescents fell into adaptive gamer group. So that was a group that did report playing a lot of computer games, so 4 or more hours a day on their computer or console, reported playing some games on their phones, and reported actually relatively high scores on well-being, so higher well-being than those that played no computer games or at all, or played some of it only. We did also identify 2 maladaptive gamer groups, so it's a small proportion of heavy gamers, 6 and 2%, but those were the young people who reported playing a lot of games on their phones, so around 2.5 hours a day. They reported high gaming addiction scores, poor well-being, and they sort of differed on how much of computer gaming they did. So one of these groups did a lot of computer gaming on top of the phone gaming, and another group reported phone gaming only. So we tried to look and see whether we can distinguish who falls into these groups by looking at sort of background characteristics and their offline behavior as well, to hopefully help see who might be the kids that are in trouble. And when we compared the adaptive and maladaptive groups, so you can see that on the right there, sort of 4 things came out as of significance here. So those in maladaptive groups were more likely to be females than those in adaptive gamer groups. Those that played computer and phone games and had poor well-being were also more likely to say that they showed aggressive behaviors, that they experienced anxiety, while those that had sort of maladaptive phone gaming profiles also reported past abuse, neglect, or domestic violence. So next slide, please. Ultimately, what does that mean? So it means that a lot of young people are playing a lot of games nowadays, and that amount seems to be, that number seems to be larger than what we used to see pre-pandemic. However, for the majority of those heavy gamers, there are few, if any, negative effects with regards to their well-being. Small proportion of heavy gamers, so 1 in 10, do show co-occurring maladaptive patterns, so sort of maladaptive sort of well-being and mental health issues. And in particular, it seems to be the gaming on the phone, particularly common in females, that may signal poor functioning. So that includes aggressive behavior, anxiety, and experiences of abuse, neglect, or domestic violence. So given the nature of the study, we cannot really say much about the causal mechanisms in there, but let's be honest, it's very unlikely that gaming on the phone is causing the abuse, right? So most likely what's happening is that the children that come from problematic sort of backgrounds or have mental health issues might be using the gaming, this heavy gaming, to help them deal with the problems they're experiencing in life. So what does that mean in general is that while there doesn't seem to be a very clear connection between the time spent gaming and mental health problems, it does open an avenue for potential interventions, as a lot of kids who do game also do have mental health problems. And that does vary for different gamer behaviors and profiles, but ultimately this might be more of a tool rather than a problem. Thank you.
Thank you very much, Simona. So what we've done is give you a little bit of a taster of some of the findings that are coming out. We have a lot of really important findings that we're just finalising now around barriers to accessing mental health care and mental health support, because this is really important. And a range of other things around substance misuse, social media use, which Simona's going to be working on next, for example. So a lot of things that we're very worried about, very concerned about, but actually, unless we get these kind of big scale surveys to really understand what's happening, we want to be confident with what we're advising, what we're saying is right. And so the gaming findings are really interesting, because actually it does reassure us a bit. We don't have to worry as much as everyone is worried, but actually there are groups that we need to focus on. So just moving to the end now, we have a website. The link will be up and running at the beginning of next week, and we'll send that to you. And you can download from there a lot of our information, a lot of our posters, and also the link to this video. So if there are other people who would like to get this taster, that's available to them. Oops. And then finally, just there are lots of ways to stay in touch with us. So if one of your partner schools, if you're in Berkshire, Buckinghamshire, Oxfordshire, Liverpool, we will be hopefully doing the survey, and Milton Keynes doing the survey February to March 2023. If you're not in those areas, contact us, because we're happy to try and work with you in your local areas to see whether we can run the survey in your area, if that would be helpful to you. We want young champions are helping us. We're working a lot in local areas. I wanted to get more and more stakeholder involvement. So we also are very keen to hear from you about areas you think are important for us to study. And also just not to forget that the data is available through the Sloan Seeker platform, which we haven't spoken about here, but there's more information on and will be on our website about how you can actually get that data directly for you. So my last word is just to thank the funders who funded this work, which is primarily the ARC, Oxford Thames Valley, and the NIHR, which is a national NHS-based funding mechanism. But the BRC, there are lots of these acronyms, but, and the Duke of Westminster Foundation as well. So that's many funders for which we're incredibly grateful, and our partner organisations. So what I'm going to do now is stop the video and stop the recording. For those of you that would like to stay and ask questions, we will stay around to answer those, but for those of you that don't, thank you very much for joining, and we hope to keep in touch with you.